My personal journey in women's healthcare started approximately about 50 years ago. 50 years ago, in the 1970s, I graduated from a medical college in Chennai. And once I graduated, there was this quest for more knowledge. And at that point in time, what attracted us most was an education in US. So we left to US in the 1970s, early 70s, to do a residency internship in US and Canada. Once we finished in 1970s, the lifestyle from here to Canada and US was so different that even without thinking, we stayed on in US, and we stayed in the North American continent for about a decade and a half. At the end of it, the pull to come back to India was very strong, and Coimbatore being the birthplace, this is where we came back. But the years in the North America that we spent was really an eye-opener, because the difference in the medical level of medical care compared to anywhere in India to what was available in North America at that time was drastically different. And I'm talking about a time when there was no color TV also in South India or any part of India. So the difference in lifestyle was extremely different. The lifestyle was one part of it, but the level in the medical care that I was used to was very different as well. And a lot of people at that time questioned our decision to come back to India to settle down after a decade and a half. But now I feel that the decision that we made back then was a wise decision and a happy decision. And I'm very, very happy that we made the decision to come back and contribute what we could to the level of women's healthcare in India. Women's healthcare has always been a passion for me. It is not an ambition, it was more like a passion. So it was like there was always a goalpost towards which I was working. And when we came back, it was like one after another we had to build up in India, in Coimbatore, in my hometown. Initially, I thought that one of the first things that I did when I came back was I thought that the level of cancers, uterine cancer, cervical cancer, was very high in India, and investigational methods like pap smear and colposcopy were non-existent at that time. So we brought in that kind of a technology to India, and then we did colposcopy classes for a lot of people and training period for a lot of people from all over South India. That was the very first thing that we established. After that, it was fetal monitor. Fetal monitor is an electronic equipment that we use in labor and delivery to make labor and delivery safer for women and children. Because I had worked in a lot of research areas around electronic fetal monitoring, like biophysical profile, back in Canada, that was the natural next thing that we went for, to make labor and delivery much more safer for women in labor and delivery here. So that was the next big introduction that we did to the scenario of women's healthcare, was fetal monitoring back in the 1970s. And after that came the advent of ultrasound. Again, I need to remind people today that ultrasound was not existent. Early part of 1970s, it was not existent. And ultrasound then became very popular much later. But again, how much it contributed in judging the welfare of the baby inside the uterus, the welfare of the mother, was not even known at that point in time. So one of the first ultrasound machines in the entire Tamil Nadu, we acquired the machine particularly to be used for women and children, women and babies inside the uterus, and the growth of the babies inside the uterus. And I think that gave a lot of safety for women who were in high-risk pregnancy and needed to have a very safe delivery. The quest for newer things and better things to do went further than that in the 1980s. 1980s was the time that assisted reproductive technology, or IVF, was born. So 1980s, where we started working with infertility in several different areas, again went in search of knowledge to a lot of places. Places like Singapore, which had the first test tube baby, Australia, Sydney, where a lot of research was going on, to UK, to several units, and gathered knowledge from all of those places. We sent people out to be trained in embryology and clinical reproductive medicine at that point in time. One of the first IVF units to be started in India was started by us in Coimbatore in 1994. And for that inauguration, the occasion was All India Congress of Obstetric and Gynaecology. for which I think there were more than a few thousand delegates from all over India. The unit was inaugurated by Dr. Paul Devroy from Belgium. Dr. Paul Devroy is the first man to have performed an ICSI procedure in the entire world, and Professor Ratnam from Singapore, who was again responsible for the first test tube baby in all of Asia. So in the presence of such kind of august people, we inaugurated our unit in 1994 and delivered the first test tube baby in 1995. So this was the start of another large saga in my life, because beyond that, and I think the developments came one after another, the ability to freeze embryos, which is called the ice baby really, where you could put a living life in ice. It's not really ice, but it's freeze it completely, take it out several months or several years later and create a life out of it was the biggest next challenge that we faced. So this was also done in the 1990s as far as we were concerned. Culturing those embryos in the human lab up to a stage 5th day was again, we were one of the first units to do that in all of India. It was a challenge, but it was a goalpost that we enjoyed running towards, and then the goalpost always kept moving, and the one advice that I have for youngsters today is that never have a fixed goal. Your goal should be one after another, bigger and bigger, until you climb the steps, and where you almost never reach the top. It always is one more goal, one more goal. So this is what I'll encourage the youngsters in the field to do today. Set your goals very high, run towards it, but you never finish it. You make another goal for yourself where you move along. This has been the story of my life, and today in the 1990s we went for a lot of other developments in the field of IVF. But 2000 and yet beyond saw that we need a better infrastructure, and Women's Center was built about that time to build a separate unit for women's health, because women's health did not have dedicated units at that time. Dedicated women's health care units, very few and far in between. So this unit, which was called the Women's Center, was built, and we didn't even want to call it a hospital, we wanted to call it a women's center, where women were comfortable, women felt at home to come in for whatever their problems were, and they were wide-ranging problems. And now we had added on pediatric care, neonatology care, oncology care, and different aspects of women's health, which are like polycystic ovary syndrome has a different clinic, menopause has a different clinic. So we addressed many different aspects of women's health. And recently, about 1.5 years ago, in 2018, saw us associating with Motherhood Group of Concerns. Motherhood Group of Concerns, as you know very well, is in women's healthcare. And women's healthcare all over India, they have several institutions, and it was a natural effort for us to go work with them and the natural partners for us to work with. So it has worked well in that now we are extending the level of care that we were providing within this institution to a lot of people outside as well. We have a transport NICU program now. What it is that when babies are delivered outside, even far outside, and if the newborn babies run into problems, the mothers or the babies run into problems, we have the capacity to send teams for neonatal resuscitation or helping those babies in the units that they were delivered, and if necessary, transporting them to our level 3 NICUs where they can be provided advanced care. In this way, we are now able to save very small babies. 700-600 gram babies are now going home in very good health and very good mental capacity as well. So today it has extended on to genetics, newborn care, a lot of other areas. We have the capability of taking an embryo and making sure that the embryo is absolutely normal genetically before we place it back in the mother's uterus. This is called pre-implantation genetic testing, and rare abnormalities that occur in the parents can be now checked for in the embryo before we put it back in the mother's womb. So the level of care that we are able to provide has gone leaps and bounds to a level which could not even have been imagined about 20 or 30 years ago. And we are happy where we are, and we like to have this service extended to as many people as possible all over Tamil Nadu.